Today we will be demonstrating the process of manual bladder irrigation. Prior to irrigation, you'll want to gather the following supplies. Your Foley catheter will already be in place. You will need gloves, both for peri-care and for intra-procedure. You'll need your facility-approved wipes for patient peri-care. Your irrigation tray, which will contain your piston syringe, your drape, and your graduated cylinder to hold your sterile solution. Green caps to protect your lines. Single-use alcohol wipes to prep and sterilize your areas. And the sterile water that we will use for installation. Your graduated cylinder will measure your output and consistency after you irrigate the catheter. So just like we do before any procedure, especially one that is aseptic or sterile, we're going to perform hand hygiene with soap and water. At this point, I have already done my patient care with the patient care wipes. I have done hand hygiene, and now I'm going to get ready to set up my supplies to manually irrigate the bladder. So reviewing our supplies, our irrigation tray, you want to double check that your supplies include your graduated cylinder for your sterile solution, your piston syringe, the drape for under the patient's catheter, and then your cap for your catheter tubing. Always double check that your supplies have not expired as well. Next, you're going to pour about 100 cc's of your sterile solution into your graduated cylinder. Be careful as to not contaminate your fluids. And then you will take your piston syringe and drop about 60 cc's. Now I will place my drape underneath my patient. Now that our drape is in place, I'm going to go over why we're doing manual bladder irrigation on this patient. They presented with hematuria with clots, and due to the limited catheter output they've had, we are suspecting that the catheter has clotted off. So before we do our irrigation, we want to remove any catheter securement devices such as a stat lock, and we will place the line on our sterile drape. Next, I will bring over our sterile solution for irrigation, and we will prepare to irrigate. Now we are ready to access and irrigate our catheter. It is very important to maintain aseptic technique with this, so we're going to start by cleaning the catheter attachment point between the patient and the catheter bag itself. So you're going to brace with a single-use alcohol swab. You're going to scrub the attachment point for at least 30 seconds. With one hand, you are going to brace the patient end, careful not to tug on the tubing. You are going to separate, and then very carefully, without contaminating either end, you're going to cap your catheter tubing and lay that down. You should have your 60 cc's of sterile solution ready to go. You're going to attach it to your catheter. Make sure it is room temperature. You do not want it too hot or too cold, as this can cause irritation and spasming of the bladder. You're going to gently instill your solution. If you meet any resistance, stop. Try pulling back gently and then instilling. If you still meet resistance, stop and notify the physician. Once you have fully instilled your volume, again, gently clamp without tugging the catheter tubing, as this can cause discomfort for the patient. This is still considered clean, so we can place it back in our graduated cylinder. You'll take your other cylinder and let it free drain, noting any color, consistency, and volume. Now we are ready to manually extract our clots. So you're going to take an additional 30 to 60 cc's of your sterile solution. I'm using 30. You're going to brace, gently instill. Again, if you meet any resistance, stop and notify the provider. Once you have instilled your 30 cc's, gently pull back. You shouldn't meet resistance with this. And in our case, there's our hematuria, as well as some clots, showing that this was what was occluding our catheter. Stop once you reach 60 cc's. So you'll notice the clots that are in your piston syringe. These were likely what were occluding the outflow of urine in the Foley catheter. Now we're going to empty the piston syringe into the graduated cylinder to measure our eyes and nose consistency and color. Note the clots are very thick. You may have to repeat these steps a few times to ensure adequate clot retrieval, but once you have done so and you have catheter patency, it is time to reconnect our Foley catheter. We're going to start using our single-use alcohol swab. We're going to clean our patient end for a minimum of 30 seconds. Then, while holding it clamped, we're going to take our catheter end, take off our cap, and with aseptic technique, we're going to reconnect and place it in our Foley securing device or stat lock. Once we've done that, we're going to do peri-care on our patient and clean up our mess and supplies.